Hi everyone, welcome back to my YouTube channel and today we are going to talk about cranial cavity. So let's start our topic with introduction. Cranial cavity is a space within the skull that encloses and protects the brain, meninges, blood vessels and cranial nerves. It forms the most important compartment of skull and is bounded by cranial bones that make up the cranial vault and cranial base. Division of cranial cavity. It has roof that is called as calvaria that is formed by frontal bone, parietal bone and occipital bone. Features here include roof for meningeal vessels and granular pits for arachnoid granulations. Then there is a floor of the cranial cavity that is also called as cranial base. It is irregular and divided into three cranial fossas that include anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Then there are walls of cranial cavity that are formed by frontal bone, parietal bone, temporal bone, sphenoid bone and occipital bones. Talking about anterior cranial fossa, it is formed by frontal bone, cribriform plate of ethmoid and also by lesser wing of sphenoid bone. Contents here include frontal lobes of brain and olfactory bulbs and tracts. Foramina in anterior cranial fossa include cribriform foramina and foramen cecum. Cribriform foramina transmit olfactory nerve and foramen cecum transmit emissary vein. Then talking about middle cranial fossa, it is formed by body and greater wing of sphenoid bone and also by squamous and petrous part of temporal bones. Content here include temporal lobes of brain and pituitary gland that is present in sella turcica. Foramina and canals in middle cranial fossa include optic canal that transmit optic nerve and ophthalmic artery. Second foramina here is superior orbital fissure that transmit third, fourth and sixth cranial nerve and also ophthalmic division of trigeminal nerve and also superior ophthalmic vein is transmitted through superior orbital fissure. Third opening here is foramen rotundum that is for maxillary division of trigeminal nerve. And fourth is foramen ovale that is for the mandibular division of trigeminal nerve and also accessory meningeal artery passes through here. And then there is foramen spinosum that is for middle meningeal vessels and foramen lasum that is filled with cartilage but internal carotid artery runs above it. Now let's talk about posterior cranial fossa. It is formed by occipital bone and petrous temporal bone. Contents here include cerebellum, pons, and medulla oblongata. Foramina and opening in posterior cranial fossa are foramen magnum, jugular foramen, hypoglossal canal, internal acoustic meatus, and condylar canal and mastoid foramen. And talking about foramen magnum, it transmits medulla oblongata, meninges, vertebral arteries, and 11th cranial nerve. While jugular foramen transmit 11th cranial nerve, 10th and 9th cranial nerve and also internal jugular vein. Hypoglossal canal transmit 12th cranial nerve that is hypoglossal nerve. Internal acoustic meatus transmit 7th cranial nerve that is facial nerve and 8th cranial nerve that is vestibulocochlear nerve and also labyrinthine artery. And condylar canal and mastoid foramen transmit emissary veins. Meninges of cranial cavity. Cranial cavity is lined by three meninges that include dura mater, arachnoid mater, and pia mater. Dura mater is tough outer layer that forms venous sinuses. Arachnoid mater is delicate middle layer that contains CSF in subarachnoid space. And then we have pia mater that is thin inner layer and it is adherent to brain tissue. Dural venous sinuses in cranial cavity. Dura mater splits to form venous sinuses that drain blood from the brain and these are called dural venous sinuses. Major sinuses include superior sagittal sinus, inferior sagittal sinus, straight sinus, transverse sinus and sigmoid sinus and cavernous sinus. Clinical significance of cranial cavity. First is cranial fractures that can damage vessels and can cause epidural or subdural hematoma. Second is cavernous sinus thrombosis that may result from infection of face or scalp. Third is raised intracranial pressure that can be detected through changes in fontanalis in infants. Fourth is foramina of cranial base that are crucial for neurosurgical approaches and understanding pathways of tumor spread. Conclusion of this lecture video. Cranial cavity is a complex bony chamber housing the brain, meninges, blood vessels, and cranial nerves. Its division into three cranial fossa and numerous foramina make it essential for neuroanatomy, surgery, and clinical diagnosis. Knowledge of its structure and opening is vital for understanding both normal function and pathological conditions that affect the central nervous system. And this was all about cranial cavity. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.